Well, a global study confirms exercise is medicine for cancer. Well, an Adelaide clinic is already delivering that. A major international study published this week in the New England Journal of Medicine has confirmed what one Adelaide-based cancer care clinic has known all along. Exercise can significantly improve survival for cancer patients and should be considered as essential as drug treatment. Joining now from Lift Cancer Care Services, the CEO, Lauren Whiting. Lauren, good morning to you.
Good morning, Graeme.
Look, I too am surprised. As being a cancer sufferer, I was told way back that exercise is a good cancer-fighting agent, and you've been doing it all along.
Yeah, no, there's been a real shift as far as how we understand exercise to play a role in cancer treatment for patients recently, Graeme. And like you mentioned, it's not something that's always brought up in the oncologist room, but we now know with no doubt that exercise is a powerful treatment for cancer patients, and we're really keen to make sure that everyone has access to this vital treatment.
And I guess that you can't sort of say to someone, who's had major surgery, look, get up on day 3 and do 3 laps of the block. I mean, the exercise has to be in tune with the state of the patient.
Yeah, absolutely. What we know about exercise is that, as you said, it can't just be something that is sort of given without careful consideration. The way that we think about exercise is the same way that we think about pharmaceuticals. So if you're being prescribed a drug, you generally go and see your doctor, and they would find out a fair bit of information about you before they decide to write a script for a certain agent. When we're prescribing exercise and delivering exercise to people with cancer, it's exactly the same. So we need to individualise the exercise, and we prescribe exercise in the exact same way that we would prescribe a drug.
Do we know why exercise is so beneficial?
Yeah, I mean, there's a lot of clever researchers sort of working out sort of some of the exact mechanisms. We know that at a high level, exercise will help people to manage a lot of the common side effects that they'll experience from their cancer therapy, such as chemo. So things like, managing cancer-related fatigue, mood, but sort of really significant things as well about maintaining muscle mass and bone density. And all of these things mean that generally patients who are having exercise treatment are able to tolerate things like their chemotherapy and radiotherapy and so forth much better, which leads to better outcomes.
Do you think that exercise should be a standard part of cancer treatment?
Absolutely. Without a doubt, exercise absolutely needs to be standard for all patients. And there's been a lot of noise about this in recent years, and certainly at Lift here, that's what we're all about. We're about promoting the need for exercise to be available to everyone who has a cancer diagnosis.
And I guess any prescription of exercise has to be in concert with the oncologist and the doctors and everyone involved. I mean, you wouldn't take that as a decision unilaterally. You'd say everyone would have to be involved as a team.
Absolutely. Yeah, absolutely. And you've hit the nail on the head there, Graeme. This is about multidisciplinary care. So, it's not just about treating, the cancer, in isolation as siloed specialists. It's about, communicating, making sure that we're all, coordinating our care. And certainly when we're at Lift looking at patients coming through the door, we don't just sort of give them a program or an exercise treatment without taking into consideration information that we're gathering from their other specialists. And, that includes surgeons, GPs, medical oncologists and so forth. So, a very, very considered approach is really, really important to make sure that the exercise is safe and appropriate.
When I was going through my cancer recovery, anecdotally, people would say to me, you have your chemo and it can knock you around a bit, so just go home and go to bed and lie down and do little. And someone else would say, no, push through that to some degree. If you can get up, and even if it's just to walk to the front door and back, just do some form of exercise and you'll benefit by it. What are your thoughts on that?
Absolutely. I'd agree with that. And, your experience is one that's really common to a lot of people with cancer, because for such a long time, that's how we viewed cancer patients. They need to rest and take it easy. But we now know that the opposite is true. So for people who aren't able to access, what I'm talking about, which is that very structured, prescribed exercise, still, anything is better than nothing. So, the advice of being able to get up and just do some gentle movement, absolutely absolutely, we'd always encourage that. But what we know is to be best is to be connected with, a physiotherapist or an exercise physiologist who's got oncology experience so that they can work with you and guide you through it. But, there's a real shift in how we look at exercise now, and certainly we hear this every day at Lift when people come in and have a look at our exercise clinic and they see patients who are, undergoing their active treatment. So they're on chemotherapy, they're coming in here, they're doing very, very hard exercise, and it doesn't always compute, because this is not what we think that cancer looks like.
It is intriguing that, this has sort of been known and practice, but to see a headline, a global study confirms exercise is medicine for cancer. It seems that, where have they been? We've known about this for a long time.
We have known about this for a long time, Graeme. Absolutely. It's been, it's been researched for a while, and it's been very well accepted. But the studies, such as the one that came out this week, is, it's just wonderful, because the more that we can have research like this, showing that exercise is in fact, just as effective, if not more, than a pharmaceutical drug, the more that we are going to get changes that are required as far as, funding and so forth, so that, so this can be accessible to everyone.
And once again, anecdotally, I know that people have said that, doing some form of exercise, and it might be even just limited exercise, they actually feel like they're doing something from themselves. Like, they've got the chemo, they've had surgery, they've had all sorts of radiotherapy and all these sorts of things. But with exercise, they feel like they're actually doing something for themselves.
Yeah, you're absolutely right. That's another huge benefit. And, the passive nature, I suppose, of traditional treatments like chemotherapy and radiotherapy or other drug therapies, is in complete contrast to, like you said, actually doing something. So what we also notice is that patients who come and get involved with exercise treatment as part of their cancer therapy, they do get that real sense of agency. There's that huge sort of flow-on effect and that huge benefit from a well-being perspective. And I suppose the other benefit, and I know this is not everywhere, but here at Lift, when patients get to see other people, who are in a similar sort of situation, they're able to develop a nice bit of community, and there's some wonderful support that flows out of that as well. So having that sense of control in a time which can feel, incredibly disempowering, and, you do feel like you lose a lot of control and a lot of, your sense of yourself, there is that huge wellbeing element that exercise provides as well.
Lauren, great to chat.
Thanks, Graeme.
Keep up the good work. Lauren Whiting, Lift Cancer Care Services CEO. Exercise is good for you at all levels, and even in cancer recovery, even maybe more so.